the hospital embraced me with open arms, and they helped me improve on my work. And given the fact that this is much more closer to my home, I get to spend more time with my wife and my kid, so that work becomes easier, knowing that you don't have to travel for 2 hours to and from your workplace. Thank you, Chinese Gen, giving this opportunity for me and my wife.
Chinese General Hospital, recruitment pa lang, sinuwerte na ako dahil very accommodating ng staff, ng HR nila. Bilang almost fresh grad nurse, I would advise the future nurses na dapat environment na mag-feel yung welcome kayo and tuturuan talaga kayo and tutulungan kayong mag-grow kagaya sa Chinese Gen.
I was very excited for the learning opportunity that CGHMC has given me. It provided me with those opportunities and as well valuable skills that will be useful locally and globally. So they always make sure that we are competent and at par with the highest standards acceptable.
Chinese General Hospital and Medical Center gave me the opportunity to start and practice my career as a nurse. And because of that, I am a nurse who I am today. I would like to say that in order for us to be a better professional in our own career, we need to have a strong foundation. And I hope that everyone will be encouraged to and try to work with them.
CGHMC is a world-class training ground that will equip you with excellent technical skills and knowledge for your future careers and endeavors. So to all the aspiring dreamers out there, take that first step and achieve your dream. Apply now and be one of us.
I had a really great time working with my colleagues as well as my supervisor. I can say that the experience I had in CGH had really molded me to become who I am as a healthcare professional today. The knowledge and the skills is truly exceptional, and that it had really helped me working here and abroad, and for that I am really grateful.
This experience has prepared me to take on challenge and be ready to work with other people from different cultures and nationalities. Chinese General Hospital and Medical Center is known as one of the biggest, best quality healthcare service with the best healthcare professional and trusted hospital, not only in the Philippines but also here abroad. Don't settle for less. Choose the best. Choose Chinese General Hospital and Medical Center for a better and brighter future.
Working here helped me build my confidence in talking to patients and other doctors and as well as our staff nurses. Tapos it helped me gain a lot of skills sa lahat, sa dami ng cases na meron dito sa Chinese Gen. I think na na-boost up talaga ang aking nursing confidence. I would just like to say na maraming salamat sa Chinese Gen at marami kayong naitulong para sa akin. Thank you.
CGH helps me to foster the knowledge and competency in working with adversity. Overall experience, I had an incredible journey to share with those aspiring future workers here in CGH. So don't miss the chance. You can be part of our fantastic team. Join us!
Join us!
Join us!
Join us!
Join us!
Come on and join us!
Join us!
Join us!
Join us!
Join us!
Be a part of our team! Join us!
Build your future with us. Come and join us.
Join us now! Sir Royce, we cannot hear you. Let's hold on, guys, for a bit. I think Sir Royce is still fixing his audio. Okay, while waiting, I'll just play a video first.
The hospital embraced me with open arms, and they helped me improve on my work. And given the fact that this is much more closer to my home, I get to spend more time with my wife and my kid, so that work becomes easier, knowing that you don't have to travel for 2 hours to and from your workplace. Thank you, Chinese Gen, giving this opportunity for me and my wife.
Chinese General Hospital. Recruitment pa lang, sinuwerte na ako dahil very accommodating ng staff, ng HR nila. Bilang almost fresh grad nurse, I would advise the future nurses na dapat the environment na ma-feel yung welcome kayo and tuturuan talaga kayo and tutulungan kayong mag-grow kagaya sa Chinese Gen.
I was very excited for the learning opportunity that CGHNC has given me. It provided me with those opportunities and as well valuable skills that will be useful locally and globally. So they always make sure that we are with the highest standards acceptable.
Chinese General Hospital and Medical Center gave me the opportunity to start and practice my career as a nurse. And because of that, I am a nurse who I am today. I would like to say that in order for us to be a better professional,
now? Right.
Yes, we can hear you.
Sorry for that. Anyway, so let's proceed for the next slide. All right, sige. Please do try to answer this. If you will become a nurse today, I would like to work in blank or country or hospital or institution. Try natin. Siyempre, we do have so many institutions to choose from. Siyempre, here in One Nurse, we do have many clients. You could browse it, especially when you become a nurse someday, right? Ay, okay. Ayan. Sa emergency, intensive care nursing, ay sa St. Luke's daw, PCHS. Ayan, very good. For the rest, try to answer sa chat box. I would like to work in a country, in a hospital, or institution. Siyempre, we do have, many specialization as well, right? Siyempre, One Nurse will provide a platform as an opportunity for us to advance and an opportunity to pursue our career ambition, especially when we become a nurse. Ayan. I would like to work in a operating room, in Pasig City General Hospital, emergency room, in dialysis. All right. Thank you so much. And then last question, what is your current hashtag? Siyempre, patapos na yung semester, especially for the, mga BSN, ongoing BSN dyan. First year, second year, even up to level 5, right? So, what is your current hashtag? Future RN 2022, sabi ni Nadia. Ayan. Natapos na yung time. Sige, pakichat. Sabi ni Rico, RN 2023. Ay mag-exam ka next year. Ayan, yung mga mag-exam or this November, right? RN 2022. Rowena, Jenny, so good luck. Si Annabelle, good luck. Si Eileen, Hannah, RN 2023. Si Katrina, good morning. Thank you for your sharing. Ayan, mag-work na siya sa Chinese General Hospital. Very nice. Registered Nurse 2022. Okay. Siyempre, to begin with, siyempre, we are here in a webinar provided by Wonder. Siyempre, there are a lot of existing job hospital or portals in the market, and it is not focused on healthcare. And here in One Nurse, syempre, the job or ads here are different from different industries. And the talent search tools don't have necessary filtering specific to healthcare. So here with One Nurse, we promise to make your, hiring fast, especially when you become a nurse someday. It's simple, efficient, and with us, you are taken care of. Syempre, our promise, of course, your interest and your needs are our priority. So please do download the application. It is available on App Store, Google Play. Please do also like us on Facebook, on One Nurse Philippines Facebook, and you can also visit our website on onenurse.com. Okay? So sino naka-register sa One Nurse or sino naka-download? Please raise your hands. Ayan. Yan, marami na nag-download. Thank you so much for supporting One Nurse. And hopefully, ayan, pag nag-apply kayo sa mga companies, ilalagay nyo, re-refer kayo ni One Nurse, or One Nurse is your main platform na, that you know for that particular hospital or institution or that, company. So with our technology, syempre, we enhance our uses every day and the experience. So by the next few months or years, we will be including our, many features. Okay. And then I will introduce our founder, Sir Hero, if you have any insights or anything to say. Are you
Hey,
here?
hi Royce. Good
Morning.
morning.
Good morning.
How are you doing?
How are you? I'm doing great.
Thank you, thank you. So yeah, actually, maybe if I can, just share my screen. We want to show what is going on in the new product, so that everybody have an idea. So let me just show my screen for 1 minute. Okay, let me know if you can see the screen.
Yes, we can see it.
You can see the One Nurse feed.
Right.
Yeah, so this is the new feature which is already available in the app as well, right? So we are becoming like the LinkedIn of the nurses, but not like too many information from everywhere, right? We are bringing only nurse related. So if you look at it, One Nurse stories are there, then One Nurse lifestyles, One Nurse blog, so a lot of good information about all nursing, career. And another good news is that today we are bringing in a few companies, and those people who are going to pass the board exam, they want to already book them, before passing the board exam, that if they would like to join the company. So some of the company will be joining and we will be, having some speaker from those companies. So those of you who are interested, you can send in your interest. We will be sending out a form to you at the end of the webinar, and then you can register your interest. So the moment you pass the board exam, they will invite you for the interview. Yeah, so that's a good news. So you can tell your friends and colleagues, to come and join in. We will be giving those interest of participation to those company, only those who join the webinar. Yeah. So thank you, Royce, and please don't forget to download the Oneness app. Maria, can you put in the Oneness download in the chat, so that people who have not downloaded, you can download and use the code NLE in order for you to download the chart. Download the app. Yeah, that's all for me, Roy. So I think maybe Chinese General, we will be doing some video, and a Legato as well. Yeah.
All right. Thank you so much, Shiro, for that. And then, yeah, so we are on October 23. So our topic is about emergency for critical care nursing. So we are on the end. So our last two topics is maternal and child, and the last one is for the exam, because the next board exam is coming. As a disclaimer, of course, the materials that will be used here are, of course, reserves the right of the owners, and this is for documentation and academic purposes only. And I believe we do have a presenter, one of our clients that will be presenting. Is that right, Maria?
Okay, thanks, Sir Roy. So currently the other client that's supposed to do the advertisement is not available at the moment. Later we will have at 10 a.m.
Okay. All right.
But Maria, are we able to play the video for Legato for, I think, 1 minute, and the Chinese Gen? Guys, Legato is a US-based company focusing on healthcare. They are a company called Anthem, and Legato is the healthcare BPO. So they employ a lot of nurses as well, and they sponsor USRN, exams as well. So we play the video for Legato, and we will also play the video for Chinese General. So do you have the video already, Maria?
Yes, shall I play for both?
Yeah, please go ahead. So Royce, just another 2 minutes, we will do the presentation for the customer.
Correct. Yeah.
Thank you.
Your future careers and endeavors. So to all the aspiring dreamers out there,
we can
take the first step and achieve your dream. Apply now and be one of us.
I had a really great time working with my colleagues as well as my supervisor. I can say that the experience I had in CGH had really molded me to become who I am as a healthcare professional today. The knowledge and the skills is truly exceptional, and that it had really helped me working here and abroad, and for that I am really grateful.
This experience has prepared me to take on challenge and be ready to work with other people from different cultures and nationalities. Chinese General Hospital and Medical Center is known as one of the biggest, best quality healthcare service with the best healthcare professional and trusted hospital, not only in the Philippines but also here abroad. Don't settle for less. Choose the best. Choose Chinese General Hospital and Medical Center for a better and brighter future.
Working here helped me build my confidence in talking to patients and other doctors and as well as our staff nurses. Tapos it helped me gain a lot of skills sa lahat, sa dami ng cases na meron dito sa Chinese Gen. I think na na-boost up talaga ang aking nursing confidence. I would just like to say na maraming salamat sa Chinese Gen at marami kayong naitulong para sa akin. Thank you.
CGH helps me to foster the knowledge and competency in working with adversity. Overall experience, I had an incredible journey to share with those aspiring future workers here in CGH. So don't miss the chance. You can be part of our fantastic team. Join us!
Join us!
Join us!
Join us!
Join us!
Come on and join us!
Join us!
Join us!
Earn us!
Join us!
Be a part of our team! Join us!
Build your future with us. Come and join us.
Join us now!
Okay, thank you, Maria. So, yeah, maybe I'll talk a little bit about Chinese Den. So, Royce, I was there last week when I visited Manila. So, I visited Chinese Den as well. They are not for profit organization, meaning they are not for profit. It's been, I think 100+ year this hospital, very well established and a very good working culture, guys. So, those of you who are interested, we will be sending out the links to you, and then you can register your interest so that once you pass the board exam, they may be able to, call you and offer a good job. So it's a great hospital. So you can consider your interest. Thank you, Maria. We can play the legato, Maria. Can you start from the beginning?
Build your future with us.
So maybe I'll speak a little bit about Legato, guys. So Legato is a healthcare company. When I say healthcare company, they belong to an insurance company, and they are the BPO healthcare arm for that company. So as a nurse, you can work in the BPO as well as a clinical nurse or on the documentation side as well, right? And another good thing is that those who want to become a USRN, they do sponsorship for the USRN, whereby you can write the NCLEX exam and you work for them, right? And if you become an NCLEX passer, your salary is pretty good. So I think we have one speaker coming at around 10 o'clock, which will inform them about how is it working in Legato. So thank you, guys. Yeah, I think Royce, one more 1-minute video for Med Grosser, which is a Philippines-based company. Then after that, we'll start the class. Thank you so much, Royce. Yeah. Yeah, thank you, Maria. So, MedGrocer is a newly upcoming healthcare company in the Philippines. With big support from company like Ayala, and they are a new kind of a healthcare company in the Philippines. So, those of you who are interested as well who participate the webinar, will be sending you a form and the link where you can register your interest. So good luck to you guys, and thank you to Cy Royce. Over to you, Royce.
Thank you so much. Of course, we do have a lot of companies. If you want to work with bedside nursing or company nursing, here we have CGH, Chinese General Hospital, MedGrocers. And if you want to work with the corporate or the clinical administrative side, right, we do have LEGATO as well. And even any or wherever you would like to work with, syempre, you're making a difference with your patients, right? And our communities. And to start with, I will be discussing prioritization and triage in nursing. Syempre, this is a lot and a broad topic as well, especially in emergency, critical care nursing, or any specialty, right? Or kahit saan mang ano yan, specialization or unit or concept. So I'll be discussing prioritization and triage nursing. Again, my name is Royce Nervaez, and you can call me Royce for short. And let's start our discussion. And I have nothing to disclose, but of course, I work with also with one nurse as their consultant, and also, syempre bringing the platform to be as active as possible as well. And doing this as an initiative for our lecture. So good morning, everyone. So if you are ready, please do raise your hands if you're here. Let me see kung ilan nang nandito. Jobert, Cherry, Rowena, nakataas kamay, Yoel, Jasmine. Sige, 26 raising their hands and going up, my heart. Okay, Alan, Pandora, sino pa? Si Clevy, Juniel, Erica, and many more. So good morning, good morning, good morning. And yung mga wala pa, pwede silang humabol, okay? Please do send the attendance link and the Zoom link, okay? So we have a fruitful discussion, and I just want to reiterate, of course, applying this concept, really important yan, especially on the board exam. Triage, prioritization. This is really, yung concept na yan, lagi yan nandyan sa ano natin, lalo na pag naging nurse na kayo someday. Prioritization and triaging. Not just in the ER, right? Kahit nasa med-surg pa kayo, bedside nursing, anywhere else, triage and prioritization is everywhere. And for our first slide, syempre, we're gonna talk about prioritization. Now, syempre, if you become a nurse, it's all about priorities, diba? Priorities. Prioritization is one of the critical functions and critical things that we do as a nurse, critical things that we do as a nurse. When we're taking care of multiple patients, a lot of patients, marami yan, nasa bedside nursing ako, nasa emergency nursing ako. So you have a lot of tasks. Siyempre, we do have a lot of patients. And, siyempre, if you work in a typical hospital settings, ayan, lalo na ngayon pandemic, right? Marami tayong mga pasyente. And those multiple tasks to do for each patient, syempre, is really vital, and it's really important that we know how to prioritize yung care natin kay patient. And syempre, it's been life and death situation as well. Diba? Papasok yan, syempre, magre-reklamo yung mga pasyente nyo. They will complain a lot because even though they know they are in need, pero syempre, we have to understand that there's a prioritization. Paano kung 40 ang patients mo, 20, naranasan ko yan, 20 patients in one shift, ako lang, at wala nang tutulong aside from your charge nurse. And syempre, it's about prioritization. It's about teamwork as well. And also, syempre, pwede tayo mag-delegate from our nursing assistants or mga orderly na tinatawag natin sa hospital. And they really make an impact, syempre. Their work, they do, syempre, lalo na yung ano natin, our role, di ba? It's about prioritization. And also sometimes patients need to understand that, right? Siyempre, it's more about kailangan explain mo sa patient mo. Yeah, all throughout. Siyempre, what is prioritization? It is an action based on the order of importance or the urgency. Order of importance of urgency. Siyempre, which one could not tolerate. Hindi nila ma-tolerate kahit na siyempre alam mo papasok sa ER, marami yan. Simple fever, cough, siyempre it's a normal or typical, situation, lalo na pag ikaw yung relative mo may sakit and you are really alarmed, 'di ba? Tapos siyempre concerned ka. Kailangan pumunta ER or magpa-check up. Siyempre you don't want to delay and you want to be treated or you're patient until a later time because baka naman pala hindi urgent. And it could affect a lot of patients, a multiple of patients, or even, as a whole. Not just a single patient, but maybe we are prioritizing between, many different group of patients. Kasi papasok yan, di ba? Dadagsaan ka. Lalo na ngayong pandemic. Sobrang dumami yung patients. Tapos kumunti pa yung mga nurses. Right? And it's part of the nursing process. Ano ba yung unahin natin? And really helpful yan to identify which situation should be addressed first. Diba? We need to envision clearly yung mga patient outcomes natin. And also, syempre, we need to predict possible problem. Possible problem. And syempre, yan, we're talking about possible problems if task is perform first. Kailangan natin i-weigh yung potential future events if the task is not completed or, you need to complete that task first or vice versa. The time it would take to accomplish, gano'ng katagal ba yan or pwede ba yung ma-delay later on na lang yan, chill lang muna tayo sa mga chill na patient or mga chill na gagawin. And the time, yung mga relationship of the task and syempre yung outcomes ng patient, di ba? You as a new nurse or, aspiring nurse, syempre, you would probably struggle with prioritization. Syempre, bago pa lang kayo, hindi po nyo pa alam, especially yung mga ganap sa yung proseso nyo sa hospital or sa ER or sa manyan, sa med-surg. And because you have not worked really thoroughly, especially yung sa patient progression, through care, mga pathways natin na tinatawag. And have not experienced that much, di ba, about those complications that may emerge in association with a particular clinical condition. So, syempre, in short, kailangan natin, we need to know the purpose, di ba? Purpose for care, what are the current clinical, picture. So, we need to know that, kailangan may judgment, picture of the outcomes or the result na is it necessary to be able to plan our priorities. So, syempre, ayan, as I mentioned, di ba, prioritization is in nursing addresses the level of urgency. So, a lot of students here, syempre, nasa level 3 and 4 yung mga diniscuss sa inyo, mga emergency, prioritization, and yan. Papasok dito yung first thing here is emergent situations. And we also have, yan, mga non-emergent and not urgent. Yan, papasok yung situation that should be done first and must be dealt right now. Kumbaga, pag nasa hospital ka, start yan, start ngayon na. Hindi mo na pwedeng i-delay yan, start. Like, you better do something about it right now. Kahit hindi pa in order ng doktor, papa-orderin mo yan kay doktor kasi yan yung judgment mo Doc. Magpapa-order na ako ng oxygen or papa-ABG na ako, okay? Pa-order na lang later on kasi kailangan pa rin yan i-order, okay? Kailangan may documentation. Ayan. These things are like ABCs. Example, syempre, of this patient may be baka hypotensive, baka may 3D pulse, or maybe the consciousness is also declining. We need to do something right now with that patient. So papasok yung airway first, syempre ABC, lalo na pag nasa board exam, syempre if you want to assess further with the patient, kailangan niya na assessment. Airway is the airway patent. Airway patent. So if the patient responds in a normal voice, tapos yung airway is patent naman, syempre probably stable yung patient. But if there's an obstruction, airway obstruction, it could be partial, maybe complete, incomplete, or complete. Siyempre, ano ba yung mga signs of mga obstructed airway? There could be, change of voice, mga noisy breathing, or mga abnormal breathing patterns, right? Tapos tumataas yung RR, or breathing effort, at baka nagsa-cyanosis na yan, di ba? Cyanotic si patient. And with that obstruction, right, there's no respiration, or baka pangit yung effort ng respiration. So baka later on, yan, there will be a reduced level of consciousness. Siyempre, it's a common cause of airway obstruction, not just, partial, but also complete. And, really important yan, lalo na patient, probably, lalo na sa emergency settings, kahit naman nasa medical surgical settings ka, maraming mangyayari dyan. And untreated airway, syempre, it could rapidly lead to, syempre, cardiac arrest. Diba? As nurses, regardless of the setting, we need to assess the airway. Paano kung nasa labas yan, di ba? Yan, nakita nyo, the patient, unconscious, syempre, yan yung unahin nyo, di ba? You need to do yan, mga head tilt, chin lift, pero paano pag unresponsive totally, magsi-CPR ka na, di ba? And paano pag nasa hospital ka, syempre, kailangan mag-suction, kailangan mag-oxygen, mo siya, di ba? High foulers or semi-foulers para mas maging comfortable si patient. At baka mababa naman yung SpO2, di ba? I-check lahat, everything. And if possible, baka may mga airway obstruction, lalo na pag nasa outside settings, at kailangan that is really an emergency. Diba? For breathing, syempre, is the breathing sufficient? Syempre, in all settings as well, it is possible to determine the respiratory rate as well. Yeah, continuous inspection of the movement of the thoracic wall for symmetry. Tapos, mga use of respiratory, mga accessory muscles. Diba? Percussion for any, probably unilateral, mga dullness, mga resonance. Ayan, papasok pa rin yung cyanosis, distended neck veins. Tapos, kailangan natin syempre ng vital signs as well. And, dapat marunong ka mag-auscultate. And, pulse oximetry. Check natin yan. Diba? For example, yan, mga patient na may tension pneumothorax, they must be relieved immediately. Siyempre, kailangan tayo magbigay ng mga cannula, and then baka nagkakaroon ng mga problem. It should be treated, baka may bronchospasm din. And if breathing is insufficient, siyempre, kailangan ng mga assisted ventilation, diba? Baka hindi pa, kulang pa yung mga nasal cannula, baka pa rin, di ba? Pwedeng mag-ventilator na, or you need to perform something like that. Lalo pag nasa labas, di ba? Pwede tayo mag-assist or give breathing or rescue breathing. Siyempre, dapat we are trained BLS or ACLS professionals. Next thing here is circulation. So, is the circulation sufficient? So, siyempre, dito papasok yung capillary refill and pulse rate. It should be assessed. Inspection of the skin for any circulatory problems. Are there any color changes? Patient is diaphoretic or sweating. Decrease of level consciousness. Siyempre, papasok din yan. Are there any decreased perfusion states? Kailangan marunong pa rin tayo, diretso pa rin yan. Vital signs, auscultation of the heart. Kailangan ba mag-ECG? Diba? Monitoring, blood pressure should be also performed. Kasi really important yan. Paano pag may mga signs of hypovolemia, hypotension, syempre, important yan on the aspect of care of patient. Kailangan mag-IV access and it should be obtained as soon as possible. Baka kailangan mag-hydration or IV resuscitation. Next would be, syempre, isasama pa rin natin yung safety. Papasok sa atin dito yung our task or process really essential to patient safety or the essential to nursing plan of care. Syempre, understanding ay kailangan na ba ng MRI agad nito, kailangan ng ABG, and something else. Kailangan ba natin, pwede ba natin to i-delegate sa iba? Syempre, as nurses, kailangan tayo yung initial assessment, right? Pwede natin itutos yan sa mga nursing assistants if they are really stable na. At kailangan i-validate pa rin natin, i-reassess natin. So next would be yan, urgent situations. So dito papasok yung these things should be mas dealt soon naman, soon pa naman. If we have an emergent situation, syempre we deal with that first, di ba? We deal with that first, then we deal with our urgent situation, di ba? Syempre, yung time, yung sensitive dito, di ba? Time is really sensitive. Things like, yan, pagbibigay ng pain reliever, medications, kailangan na ba ng laboratory, as I mentioned, ay baka kailangan lang ng dressing changes or baka yung ibang patient kasi kailangan lang ng prescription, right? So we need to deal with that. We need to know if it's emergent, urgent, and not urgent. And that is soon. And lastly, syempre, but still, as I mentioned here sa slide, they are still risk for emergency. And not urgent, syempre yung mga, we could deal this later on. It could be in general, baka some sort of elevated temperature or steady naman or normal naman pala yung vital signs. They are within normal limits. Pwedeng conscious si patient, aware, ay chill lang pala. Kailangan lang ng mga gamot. And this could be all about being stable pa rin. Siyempre, those things could be, pwede rin baka gusto lang magpapalit the patient ng mga IVs, changing of linens, lahat yan sa emergency, they need to be comfort as well. Lahat may needs. But we don't need to do them soon, syempre. They need to be done later on. Okay? So, but on the other hand, syempre, pag nasa ER kayo or critical care or anywhere else, syempre, on the ideal setup, papasok naman dyan yung team mo, di ba? Marami naman kayo. But, syempre, paano pag sa board exam? Pipili lang kayo ng isa. We need to, hindi naman natin i-risk yung other patients. But still, yun yung important eh. Ano yung priority first? Or ano yung gagawin na una, di ba? Now, syempre, it's interdisciplinary communication. Collaborate tayo sa other people in our care, right? Other nurses, the providers, even the pharmacists, respiratory therapists, nandyan yan sa emergency lagi. Lagi yan umiikot. Respiratory therapists, they're there. We can really start caring for our patients pag yung appropriate level of priority and with the help of our interdisciplinary team. So, syempre, we're talking still about prioritization. It's important that we consider this interdisciplinary communication because this is where all the different functions in the hospital are gonna start, diba, together. It's about working together. So, for example, syempre, may mga patient na, for example, mga hypotensive, that is something that we must be there, diba? We need to deal with them right now. So, ayan. Baka kailangan din ng mga other things like, magpapa-nebulization or magpapa-ABG, nandiyan si RT or mga medtech, diba? Kailangan natin i-delegate yan. Hindi natin kaya lahat. So, baka, it's a situation that needs to be addressed first. We're dealing about different disciplines. Consider the priority. Siyempre, yung priority, siyempre, doon ka focus kay patient. dito muna ako kasi syempre yung airway, really important here. Dito muna ako. Later on na yung other patients or i-delegate na lang sa ibang nurse. Syempre, critical situations could become very, very stressful, di ba? We need to be careful that we are also watching ourselves as well. And mga patient, grabe magrereklamo yan, syempre for sure. We need to listen pa rin on, we have to explain those things to our patients. Lalo na yung mga relatives, right? Communication yan with patients, collaborate with other healthcare team. Mga information, syempre, may mga data privacy naman tayo, di ba? So sometimes situations prevent us from leaving the bedside. So kailangan we still follow the, the privacy, confidentiality. And as I mentioned, yan, yung rapport with our patients. It's also important that we realize those things. And syempre, stressful na nga eh. We don't want to be rude to our relatives, even to ourselves, right? Yung feeling mong nag-i-strict ka or medyo nairita ka na talaga. Syempre, stressful yung mga situations. And we just need to be cool about it. Diba? Work with everybody else. And if really kailangan talaga ng arises na kailangan ng additional staff, pwede kayong tumawag sa mga nursing supervisors nyo para at least, kasi minsan ibababa yung ibang staff na non-toxic or baka dinagsa talaga yung AR or yung isang settings. Diba? Even if it's stressful, you need to be respectful with other people and kailangan continuous yung delegation. Okay? Now, if we plug in with, yan, papasok syempre, pa rin, important yung Maslow's, right? Hierarchy of needs. Syempre, we start with the physiological. We can really start caring for our patients in the appropriate level of priority. Appropriate level of priority. So we need to make sure, ayan, we consider individual patient needs versus other patients. I already mentioned that lahat ng patient may kailangan yan. Kailangan ng gamot, yung iba nahirapan huminga. So, syempre, you need to know, what is your priority? What you could be also delegate or what could you do later on. Kanina sinabi ko na yung ABCs tapos safety. And then papasok yung mga physiologic needs. We'll tackle that later on. Tapos, considering there's a lot of things that we need to be careful for our patient, ayan, papasok yung efficiency. We need to cluster our care. Siyempre, may mga endorsement ng mangyayari, diba, handover. So, iikot kayo sa mga patients. Hindi lang sa med-surg yung umiikot, sa emergency, umiikot yan sila. I-endorse na yung nangyari kay patient. And then, syempre, mag-iiba yung shifting. You consider, makikita mo naman, especially with the use of your clinical eye, and not just on the, handover or yung pinaka-paper itself. You need to know ano yung priority. Saka yung may mga gagawin ka bang other or pending mga laboratories, mga procedures, medyo na pala na medications, right? Consider what the patient needs to be dealt with first. And then, you care for a certain specific or needs of an individual or patient na kailangan i-cluster mo pa rin yung care mo all throughout your activities. Kasi at the end of the day, ikaw rin yung matotoxic, diba? Ayan. So now, consider yung mga stat orders and stat labs ay in-endorse sa'yo ng isang outgoing nurse. Siyempre, tulungan kayo, hindi nyo siya papagalitan. Ay, ba't hindi pa nagawa yung mga stat orders? Ay, hindi pa kasi na-follow up. Ipa-follow up ko na lang all throughout. Diba? Stat orders, stat labs, kailangan na mag-MRI. Kaso yun nga, we need to know the policy first. Baka kailangan pa ng mga NPO, ay kakastart pala ng NPO ng patient, ay due pa siya later on. So, magpapabuka na sa radiology, right? Recognize the impact that the orders and labs have on this patient. Ayan, di ba? really time essence yung mga laboratory na yan. Eh, what if, syempre, kahit naman makikita mo that there's a signs of bleeding or you recognize, syempre, that there's a need to check pa rin yung, di ba? Like mga CBC, di ba? It's really urgent, lalo na, ay baka magpa-stat, transfusion ka na pala. Okay? So, making sure you're dealing with those values and those labs as well as you need to. Especially with the more important ones. Ay, kailangan mo pala ng mag-ABG. At, ayan. Diba? Prioritization is a process. And keep this in mind, lalo na pag naging nurse kayo. Diba? You must be adaptable with those situations. Hindi lang yung magbibigay kayo ng gamot. I-check nyo pa rin yung mga imaging and labs. Diba? Also, not just treat the machine. Diba? You need to treat the patient. Your priorities for your patient, for your shift are going to change, you know, yung a situation, di ba? Lalo na, ayan, pag nag-hospital talaga kayo, kailangan you evaluate also what is your priorities here at any given moment, okay? So, yung mga concept na you remember and you need to be understand. Papasok dito yung clinical judgment nyo. So, yung how do you plan for your patients, ano ba yung mga na-foresee mong mga kailangan gawin kay patients, and, you know, just evaluating the urgency of that situation. Is it emergent? Is it something that must be done right now? Diba? Is it urgent or something that must be done soon? Or is it not emergent? That can something be done later on. Tapos papasok si Maslow's of hierarchy. Think about the patient's level of needs. Ayan. Cluster of care, di ba? Prioritize. Ano ba yung unang patient na uunahin natin versus a lot of different patients. Siyempre, realizing that hospitals could be really stressful, not just with the patient, but you also in a working, you know, situation. But you deal it with professionalism and appropriately, diba? Important to remain professional. So Maslow's hierarchy of needs, syempre, alam niyo na yan. It is developed by kay Abraham Maslow's. It's a psychological theory based on the human needs, diba? Based on the priority needs. So when we talk about Maslow's in nursing, nurses should prioritize care for patients based on this model, diba? Use Maslow's to determine which patient should prioritize first. Papasok yung physiological needs over self-actualization needs. Sa baba muna tayo, diba? Meet physiological needs or needs to be done first, diba? Patients become they become winded during conversation or now yung oxygenation, right? Even yan, nakita dito, breathing, okay? So that is the one that needs, diba? Syempre, physiologic yan. Prioritization is really important here. And patients often come to the hospital with, syempre yan, hindi lang yung physiological, patas yan. They need to meet their unmet needs. Kailangan papasok dito yung assessment. Still, diba? Papasok yan. Encourage the safety needs of our patients. Observe the safety, yung mga ano natin, in the patient's room. Are there any threats, diba, na mangyayari? Kasi marami mga aggressive na patient. May mga suicidal, tapos may mga ano talaga, iba-iba yung mga behavioral mental health status as well. Diba? Encourage a safe environment and engage in a safe behavior you as a nurse. Siyempre, dadagdag ka pa ba? Toxic na nga at baka ma-threaten din si patient. Siyempre, ayaw nila magre-reklamo yun sa love and belonging needs. Siyempre, nurses should establish or build rapport, diba? And friendship, family, encourage family support. Kaso nga minsan, di ba, usually sa ER, nakalimit ang mga relatives, isa-isa lang or dalawa-dalawa. Kasi dadami yung dadagsak na nga, di ba, yung patient, dadami pa yung family. Although we are, family-oriented kasi, di ba, in the Philippines, as long as even just one, presence of the family or a relative or a spouse, may asawa, or baka nga yung mother and father, right? Siyempre, presence of the relative is really of important here to provide a healthy and positive environment as well, diba? Self-esteem needs, yan, papasok dito yung mga, it needs to, yan, kailangan ng mga counseling, it needs to be met through, yan, mga therapy, at syempre, kailangan magbigay pa rin tayo ng positive, realization to this patient, diba? Kailangan natin, we encourage those confidence, simple achievement, syempre, nakakalakad na siya or nakaihi na si patient, diba? You need to provide a positive, report to that patient. Respect as well, respect your patients and respect also the relatives and then those behind you as well, diba? Self-actualization, syempre yun eh. Diyan napapasok yung long-term needs. Ayan. Nakita mo, nasa ER na patient, na stroke pala. Tapos nakita mo, pumunta ka sa med-surg, nag-ano na siya, nag-rehab, diba? Focusing on the long-term goals. Diba? Papasok yung acceptance on the patient side. Nag-rehab na pala siya. At you're really happy, na-discharge na pala. Diba? You're working here as a nurse and then yung hierarchy of needs will also be helpful, especially meeting the prioritization. There's a lot of issues, a lot of things, and then, syempre, papasok dito yung mga rationalizations that we have to answer those and prioritizing yung care ng patients. Okay? Ayan. Dire-diretso yan. Lahat yan. ABC, and then Maslow's prioritization, clinical judgment. It really becomes, kailangan, it comes into play on how to use your judgment. Critical thinking in nursing care. Okay? Sige, let's start with the first question. Try nyo tong answeran. Sige. Please use the chat box or the class point app. The nurse is working in the emergency department. Which of the following should take priority? Then, 9, 8. Sige, patry sa class point para makita natin. Alright. A versus D. Sige, A versus D. Sige, unahin natin letter C. Siyempre, constipation for 5 days, abdominal pain, probably last or third to the last yan, di ba? Siyempre, kailangan pa rin natin i-address yung pain niya. But still, it could be treated next. But it's not yet an emergent situation, di ba? Okay. 3 or 4. Hypertension and urinary retention. Yan. Pwedeng second and third. Siyempre, hypertension may be due to, baka nga, may retention, di ba? Urinary retention. Siyempre, there could be a blood pressure elevation. So, we should be able to quickly pa rin address this situation. Sige, pwede natin i-second siguro to. or third. After, ayan, nag-marijuana, syempre, magkakaroon talaga ng mental status changes. And there could be impairment of body movements. These are side effects of substance abuse, and probably that patient may be stable as well. Okay? A client with glucose of 500, ayan, sobrang taas, di ba? Nagdi-DKA or HHNS. And the client has, ayan pa, meron pa mental status changes. So DKA yan probably, di ba? Dapat ma-address yung glucose level, address immediately, di ba? Lahat yan, the rest, ano naman, mas stable pa, di ba? All throughout. So letter A, at sobrang concerning yung letter A, 500 glucose at mental status pa. Baka makoma yan at baka mamatay pa rin yan, for sure. Okay, so letter A. Clear, taas kamay. Nandyan pa ba kayo? Sige, taas kamay dyan. Nandyan ba? 6 participants, 5 raising their hands. All right, next. Sige, nasagot ng iba sa ano? C, D, D sa ano natin sa app. A, B, C. C ang pinakamadami. At D, 36%. Sige, let's try. Unahin natin dyan. How often are we gonna give the antibiotics? Ayan. Mas concerning ba yung magbibigay agad? Ano ba yung due ng medication? Kasi uso yan, syempre, yung ED nurse mag-endorse yan pag stable na yung patient, right? Sa surgical or med-surg. The client is experiencing hypertension. Ayan yung situation, di ba? Yan yung ano niya, pinaka-complaint. Hypertension. Which question is a priority? Antibiotics, oh. X na yan kasi hypertension daw. Did the client get any medication for blood pressure? Oo, for sure, meron yan nagbigay ng medication. Pero it is readily available naman usually, di ba? Pag nag-endorsement at magbabasa naman yan ng chart, titingnan mo, ay, ano ba yung mag-ano ka, med-recon or mag-check ka ng medications. And it is necessary but still, di ba? It could be found naman sa ano, readily available. What is the blood pressure? Or when was the last? Ayan. Still important yan yung blood pressure, di ba? Ay sobrang elevated. Pero kaya nga i-endorse natin sa med-surg, ay baka probably stable naman pala. And lastly, letter B, client experiencing hypertensive symptoms. Ayan. Baka it should be addressed syempre yung mga hypertension na yan or yung mga hypertensive symptoms, di ba? Out of the listed, yung letter B yung kailangan natin i-prioritize from the others. Paano kung symptomatic si patient, right? Baka kailangan nyo pa rin anong last ECG or baka kailangan pala mag-ECG. May chest pain pala si patient, di ba? The nurse would need to, prioritize that situation. Assess ka, papasok ka din, di ba? Especially on the aspect, you would have to contact, syempre, lalo na pag nandiyan naman yung mga residents or providers, baka kailangan na ulit mag-check ng ECG or something else. So letter B, is the client experiencing hypertensive is really important to make a clinical prioritization. The rest, ano naman yan? Di ba? Protocol, syempre magbibigay ng blood pressure, medications, ano yung BP. If we are to ask, syempre kailangan alamin natin yung other symptoms, di ba? PQRST, di ba? Or all guards, di ba? All guards. So letter P. Okay, malinaw, clear, taas kamay. Okay. Next. Okay, please answer on the class point as much as possible. Ayan, sagpanay natin sagutan. Rectal tube, letter D daw. Meron din B, PEG. NGT 5%. Orogastric tube, 5%. Ano nangyari? Nurse is carrying with a history of herniated small bowel. The patient reports has not been able to push the hernia back. Syempre, really painful yan. After the CT scan, the client is diagnosed with incarcerated hernia of the small bowel. What is the priority for this patient? Unahin natin yung rectal tube. Will it improve the situation pag mag-rectal tube ba tayo? Siyempre, there is no indication that the usually sa mga diarrhea or pag hindi talaga kaya, di ba? Magkakaroon ng rectal tube. Not having a significant diarrhea. Orogastric tube naman, siyempre, the patient would not be used, orogastric tube, syempre, awake and alert naman si client, and this is not appropriate for this situation. The PEG or NGT, ano ba yung mabilis dyan ilagay, di ba? Yung PEG, pupunta pa kayo sa endoscopy unit, di ba? Although, syempre, it's really unnecessary in this case pa rin. The client should be able to receive a NG tube, di ba? NGT, letter C. Letter C. And yung PEG kasi, yan yung mga patient na kailangan, yung hindi na-tolerate yung, di ba? Yung food, so kailangan mag-PEG. Or baka hindi na talaga kaya sa NGT. Siyempre, yan yung laging initial, di ba? Mag-NGT muna. Although kahit hindi nyo alam yung disease process na yan, right? Placing an NGT is a priority here because yung, i-decompress niya yung stomach to prevent further foods or liquids from entering the small bowel, di ba? The client should be on, kailangan may bowel rest na tinatawag. Meaning they need to be on NPO status until the small bowel could be used again. Baka kailangan later on mag-surgical reduction na yan or repair. Okay? So letter C. Next. Ay, patumulit pala. Sorry. Ang kulit. Hindi ko ko napansin actually. Next muna tayo. Sa letter C. Ito. Prioritizing beginning of the shift. Client with which of the following priority siya. Alam mo niya yan, for sure. Ayan, alam niyo na, di ba? Airway breathing circulation. Priority. Ankle injury, not that life-threatening. Could be the last. Rashes could be a low priority as well. Could be third. Although, pag sinabi siguro may mga trouble breathing, di ba? Or yun nga di ba? There could be a risk for losing the airway. Baka kung may anaphylactic shock or signs of shock, anaphylaxis. And then, yan, important pa rin yung epigastric pain, di ba? Kasi nga, baka naman cardiac related. Although, syempre, ABC muna tayo, airway, di ba? ABCs. Then, the rest will follow. Okay? Letter D. All right. I think we'll have a mini commercial break with our friends from Chinese General Hospital. I believe that they will be presenting for some few minutes. And I have here Miss Shaira Sarsona, of CGH or Chinese General Medical Center, Hospital Medical Center, to talk about their hospital and their institution more. Okay? Miss Shaira, are you here?
Okay. Hi, Sir Royce. I'm sorry. I think it's not Miss Shaira. Let us call it Miss Precious Miranda from Chinese General. Hi, Miss Precious.
And what's her name here?
Precious Miranda.
Hindi ko siya makita actually. Si Miss Shaira nandito. Good morning, Chinese General. Are you here?
Hello, good morning. Can you please give us 5 minutes? This
Okay.
will be
Sure.
in a few minutes.
Sige. Sige, let's start muna yung natin, Q&A, while waiting for the Chinese General Hospital. Sige. The patient presents to the ER. Yan, difficulty of breathing ulit. Squeezing all around my ribs when I try to take a deep breath and making nauseous. Anong priority nyo for this patient? Binaw. Sige, tingnan nyo nag-iging. Squeezing around my ribs. Nauseous. Sagot nyo. Ayan. May auscultation, may oxygen, may blood pressure, may ECG. Oxygen daw. Okay. Oxygen. Check blood pressure. Sige, unahin natin to. Siyempre, that is not a priority at this time. Baka si patient baka may MI yan, di ba? squeezing, tapos making nauseous. Ano ba priority pag may patient may nag-MI or baka nag-chest pain? BP, sige. Later on, sige, mag-vital signs tayo. Diba? Auscultation of the lung. Oo, important yan, di ba? Assessments. Although, nakita mo naman, yan ay usually pag nandiyan ay assessment, probably huwag ka nang ulit mag-assessment kasi may gawin ka na, kailangan ng gawin, right? The patient may, wala namang sinabing mababay SpO2. Unknown yung SpO2. Asan yung SpO2 dyan? Di ba? Difficulty of breathing. Diba? Nahihirapan at nauseated si patient. Lalo na itong mga female patient, diba? They tend to report mga atypical symptoms lalo na pag may MI. B or D? Kung papalitan nyo yung sagot nyo, B or D? Correct. Diba? Yun. Kung papalitan yung sagot nyo, important naman yung oxygen, but first the oxygen saturation, right? Bumababa ba? Or although nakita nyo difficulty of breathing, right? Oxygen should not be given without assessing as SpO2 first. The patient, nakapagsalita, sabi niya, it's making me nauseous, di ba? Medyo chill pa siya. Di ba? The airway might be patent, but the SOB is not that significant naman, di ba? If, obtaining vital signs was an option here or, or checking SpO2, baka yun yung pinaka-priority means versus the need for oxygen. And then, syempre, pag mga typical MI symptoms, ano ba inuuna, di ba? Kailangan nyo mag-ECG for sure this one. Kailangan, marami lang akong ganyang patient na yan, hirapan at sumasakit yung ribs or, lalo na pag deep breathing, making them nauseous. It's a typical or, yan na, MI. It's imperative or kailangan i-roll out yung MI in this client. So letter, ayan, pinunta nyo na yung sagot nyo. Letter D, okay? Ba't yan may nagsulat? Letter D versus oxygen. Oo, you could do oxygen pag na further assess na yan, di ba? Kailangan, we cannot assume they need oxygen, di ba? Ganyan yung mga situations na we cannot assume that we need to apply oxygen without knowing the SpO2 as well. Okay, so letter D. So, ayan, at least, di ba, dalawa na lang yung pinagpilian nyo, ma-inekis na kayo. So, may 50% chance pa rin kayo, di ba, for sure. So, knowing that, ayan, stress strategy taking pa rin, still may 50% chance. So, letter D. Ayan, the patient and taking mga opioid medication or mga pain reliever, morphine, lorazepam, cyclobenzaprine. Siyempre, mayroon tayong katulong sa ER or sa critical settings, may nursing assistant. Inutusan natin mag-RR. Sinabi niya, attenda yung RR. Nursing assistant. Ano yung priority mo as a nurse? Diba? Hanapin ba agad natin si doctor? Ano sagot niya dito? Hindi ko ma. So letter A, call MD to order naloxone. Ayan. Important yan, but still, wag nyo muna hanapin si doctor, di ba? May gagawin muna kayo lagi. Huwag nyo hanapin lagi at laging iasa kay doctor muna. Next, obtain bulb mass and deliver 20 breaths per minute. Okay, sige. Maganda rin yan. Double check prescription na yan. Saka na yan. Kasi probably, baka naman nagbigay na later on. Oh, pero check nyo pa rin, di ba? Reassessing is really important. Especially pag may dinelegate ka sa isang, unlicensed professional. Although they're really helpful in the team, but we need to understand that that is one of the, interventions from the nurses. We need to reassess. Ano ba yung RR? I-double check natin versus the others. Then later on, we will do, the rest will follow, di ba? Assess. RR ay nagkakaroon ng respiratory depression talaga si patient. Less than 10 ay baka, yun nga, side effect ng mga morphine, di ba? Depressant. Kailangan mag-naloxone to relieve or yun yung di ba, antidote. The rest, pwede na tayo ma-oxygen pag na further, na natin, okay? Confirm, okay? Letter B. Ayan. Lalo na pag may mga pumasok na sa board exam, may mga nursing assistant. Validate natin. I guess our friends from Chinese General Hospital and Medical Center is here. So let's have Miss Precious Miranda from Chinese General Medical Center. Are you here? Good morning, Ma'am Precious. Miss Precious? Oh, ay, baka kailangan i-unmute.
Hello, good morning.
Good
Hello,
morning.
sir. Good morning. All right. Okay, so good morning, everyone. It's a great day to be with you all. So I would like to thank you so much for the opportunity that you gave us po to present our company. So let me share my screen with you. Okay, and tell you something and more about Chinese General Hospital and Medical Center. Okay, can you see my screen?
Yes.
Does everyone can see my screen? All right, thank you. For a while. Ayan. Okay, so let me start first with the mission and the vision of our company. So the mission of Chinese General Hospital and Medical Center is to provide a holistic and then a competent, compassionate quality healthcare to our patients, regardless of their status in life, race, social status, and of course, we also one mission of Chinese General Hospital is to also provide a healthy and nurturing and learning environment for our employees. Okay, and our vision is to be the facility of choice in compassionate, innovative, and quality healthcare by 2030. Okay, so HR department is now looking for nursing associates and staff nurses. Okay, so what are the qualifications that we're looking for these positions? First, for the nursing associate position, you must have a bachelor's degree in nursing. In short, nursing under board. So it doesn't matter if you're not yet registered. If you're interested to apply, you may send your resume with us. Okay, and then you must also be willing to undergo BLS training. And for our staff nurse position, you must be a registered nurse. Okay, but if you're not yet planning to take the board exam, or yes, if you're here, syempre, automatic naman, you also plan to take a board exam. That's why you're here right now, having your review. So right now, since wala ka pang lisensya, okay, you may apply for nursing associate position while waiting for the exam date. Okay? So with or without experience may apply, and of course, all fresh graduates who are now here are welcome to apply. Okay, so what are the benefits and the compensation package that we offer? Okay, so I will not discuss it detail by detail because we only have a short time, but yeah, I will discuss to you all the things that you need to know about the position. Okay, for the nursing associate position, we offer 22,000 gross monthly salary. So meaning there are deductions every month. Okay, we are the one who will pay your monthly contributions in the government. Okay, and besides that, we also offer probationary benefits for this position, such as free pre-employment swab test and COVID-19 benefit package. So what are the COVID-19 benefit package that we offer? First, we can offer you a paid quarantine leave. So in case that, for example, you felt symptoms while you're working in Chinese Gen, okay, and if you tested positive, the days that you were absent, okay, we will be the one to pay it. Okay, and for the free hospitalization, if COVID is the reason, of course, we will provide you a free medical assistance for that. And of course, paid monthly government contributions. And another probationary benefit that you will expect from us is an opportunity for career skills enhancement, because the HR department of Chinese Zen is very active in providing their employees trainings and programs that will really benefit their careers. Okay, and for our staff nurse position, so we really have a kumbaga, complete package for our that we offer for our staff nurses. Hindi lang siya compensation at benefits, but also we offer signing bonus for our staff nurses. So first is yung of course, benefits namin bukod sa free pre-employment swab test, we also offer transportation or travel reimbursement for those nurses na galing pa ng probinsya, okay, or far areas in Metro Manila. And at the same time, we offer leave balances such as paid quarantine leaves, 40 days paid leaves. I hope you can see the details on our job ad kahit medyo maliit siya. So I hope you can bear with it. Okay, and then of course, we offer an academic assistance program for a while. I'll just put a pointer para alam niyo po kung saan ako ayan. All right, so yan, going back, so we offer academic assistance program. So we can offer you a 50% discount tuition fee in case, for example, you have a qualified dependent, let's say your sibling or your kid, okay, and magka-college na siya. So they can also apply or enroll to CGH colleges, okay, and then they may avail the 50% discount tuition fee. Okay, that both applies to our employees and to the qualified dependents as well. And we can also offer accommodations for those nurses who are kumbaga residents from the provinces. Okay, and besides that, we also offer 100% hospitalization for our employees, and at the same time for your qualified dependents as well. And of course, the 28,000 we offer that monthly. Okay, if you want to know more about the details, okay, don't worry, we will discuss this during the interview. Okay, for a while. Wait, my screen. I'm sorry, I'm having troubles with my internet.
Shall I do the screen sharing for you, Miss Precious?
Sure. Thank you so much.
Which slide? I'm sorry, which slide are we in? Here?
Slide 8.
Yeah. Yes, that one. Thank you so much. Yeah. Okay, thank you so much. Okay, so where are we? All right, so going back, okay, for our staff nurses, staff nurse position, All fresh graduates may apply as long as you are licensed, but if not, you may choose the nursing associate position. Okay, so let's next slide. Okay, so what is our recruitment process? So next slide. All right. So as you can see here, okay, we've made a timeline, or let's say a step-by-step process on what will you do if you are, in case you are interested to apply. So first, whether virtual or walk-in interview, we entertain them. For the nursing associate position, we entertain scheduled interviews, and it is only 1 day hiring process. So it means that the initial and the final interview will be also done in the same day. And you will also know the same day the result of your assessments. Okay, and it is done through face-to-face interview. Unfortunately, we cannot do the virtual interview for our nursing associate position right now, since we have lots of applicants to entertain. Okay, and then for our staff nurse position, of course, we accept or entertain both walk-in and scheduled interviews. So in case that you want to do a walk-in, okay, we are located at 283 Blumentritt Street, Santa Cruz, Manila. So in case that you want to drop by, okay, you are free, okay, as long as you visit us at HRD office by 9 a.m. or let's say by 8 a.m. until 11 a.m. kasi that is our cutoff for our applicants. Okay, and it is also 1 day hiring process, and we accept applicants or interview applicants through face-to-face and virtual interviews as well. Okay, so once you're done with the initial and the final interview, of course, we will instruct you already the same day the requirements that you need to complete. So we normally give them 1 to 2 weeks allowance for our applicants to complete everything. And then after they have submitted, including their medical requirements, if they are physically fit to work, okay, by our company physician, okay, they may now proceed to our onboarding. Okay, so we will now schedule you that moment as what I can say is that we will now disclose to you that same day the schedule for your orientation. Okay, so next slide. All right, so I hope you are encouraged with everything that I have mentioned, even though very quick lang po yung aking pagdi-discuss. But yeah, if you want to apply with us at Chinese General Hospital and Medical Center, okay, you may submit your resume at recruitment.hrd@cghmc.com.ph, or you may also send your resume on our One Nurse link. Okay, Ms. Shaira will also provide that on the chat box. Okay, and if you want to visit our Facebook page to get an updates for regarding our job ads, you may also visit our Facebook page. Just type Chinese General Hospital Human Resource Department. Okay, or you may just simply copy this website link, okay, that you can now see on your screen. And we also have, of course, the company also have its own website. Okay, if you want to know more about Chinese Gen, how the company is going, kumbaga, how Chinese Gen is well established, okay, you may also visit that website. Okay, at cghmc.com.ph/online. Okay, thank you so much. So that's all. Thank you, One Nurse.
Thank you so much, Miss Precious, for the presentation. And yeah, please do apply with CGHM. Maganda yung mga benefits nila for the nurses. Lalo na pag naging nurse na kayo, diba?
Yes, I may also add that Chinese General is masyadong mabilis yung hiring process
Okay.
ng General.
Maganda yan.
Very good
Kasi
thing.
dati talaga sobrang daming, diba?
Yes.
So really important yung fast hiring process and also yung benefits. May one last question dito. May age limit daw saan yan? Nurse associate pa tinatanong mga trainer.
Hello, thank you for the question, sir. We don't have actually an age limit kasi hindi naman kami, wala naman kami age discrimination. But of course, dapat hindi malapit sa retirement age. So considering the fact that 55 years old, we are hiring them.
Ayan. Sabi ni Bella, still be available. Of course, available yan. Continuous hiring yan si CGH. Hihintayin ka nila, Bella, pag naging nurse ka na, di ba?
Yes, yes po.
Correct. All right, sige. Thank you so much, CGH, Chinese General Hospital. And for our student, yan. Pag you want to step in your career in the bedside nursing, apply kayo sa CGH because of their, nakita naman natin yung mga testimonials na mga nurses, di ba? Really positive feedbacks. At nasa ibang bansa na rin sila, di ba? Taking care of their employees and their nurses as well. Yeah. Going back to our lecture, can you see my screen? Please raise your hands if you're still here. Ayan. Tama ba na yun? Yan. Pag may mga nursing assistants tayo or associates, of course, you are trained, but still nurses should reassess, reconfirm, and then the rest will follow. Okay? Letter B. Next question. Ayan. Patients receiving opioids for pain, greater risk for respiratory depression. Young female with advanced multiple myeloma, heroin addiction, all patients, patient with fracture and cystic fibrosis. Siyempre, one of the really at-risk patients, syempre, yung mga old patients, yung mga may underlying lung disease. Diba? Ano pa? Yan yung mga opioid naive adolescent. Meaning, opioid naive means they are chronically receiving opioids. Hindi pa sila they are not chronically receiving opioids on a daily basis, meaning wala silang opioid prescription in the preceding 6 months. That is 3 of the risk patient. Yan. X muna natin yung heroin addiction and back pain and with patient with chronic disease like cancer. Diba? Si patient with lung disease at opioid naive pa. Ito si patient, chronic pain, stable naman yan, although matanda, but still 2 out of the 3 is here, right? Versus 1 out of the 3. Lalo na to, may patient may lung condition, di ba? Siyempre, ang cystic fibrosis is di ba? It affects the lungs and even the digestive tract, di ba? They produce mga excessive mucus, they could have, mga lung concerns talaga. They having shortness of breath, tapos nag-analgesia pa siya, right? So the answer here is letter D because this has the 2 of the risk factors. Although adolescents still, di ba? As I mentioned, opioid naive, yung mga patient na hindi nagtitake ng chronic receiving opioids on a daily basis. 1 of the 3. So 2 out of the 3 is here. So letter D ang prioritization. Ang answer nyo dito, yan, perfect. Letter D ang mga may answer. Majority answered letter D. Lalo to, di ba? Concerning yung may lung problem. Next. Last question for this concept. Ayan, papasok yung ABC. Diba? ABC. Leg pain, chest pain. Although, yan, probably may concerns like MI versus airway. Diba? Sige, X na natin si leg pain muna. Sige, pwede natin pa-open muna si leg pain. Lowest priority. Why? Because it has nothing to do with airway, breathing, or circulation, given the situation. Chest pain, emergent naman yan, but still maybe probably related to circulation. Okay? Chest pain is the next priority. Okay? We are talking about angioedema saka COPD with exacerbation. Diba? Papasok dito yung airway and bleeding. Ano ba na nangyari kay COPD? Siyempre, related to breathing. Diba? Exacerbation. It's a second priority. Angioedema, ano nangyayari? Siyempre, it's a rapid edema. There could be a swelling, diba? On the area beneath the skin or the mucosa, diba? It could happen all over the body. It is normally could be a allergic reaction. And then, syempre, with this angioedema, there is a concern, there could be a loss of airway, di ba? Yung COPD, pwede pa yung ano yan eh, oxygen or baka bumababa lang yung SpO2, but still, di ba? Normal naman kay patient na may mababa yung SpO2, lalo pag may COPD. And then, using the airway, breathing, circulation, syempre airway is first, angioedema. There is a concern of loss of airway. The rest will follow. Letter A. Anong sagot dito? Ayan. Letter B. COPD. Oh, tama yan. Important yan. So, but with this situation, di ba? Oo, sasagutin ko rin talaga yung COPD dito. But still, you know, there could be a concern of the loss of airway. So, letter A. Angioedema. Okay? Then, COPD. Then chest pain, then leg pain. Ayan. We're talking about triage, still the same. And ano pa rin, connected to the prioritization. Siyempre, we are talking about understanding how working in a hospital with a pretty high level of this. Yan yung categorization of severity. It's one of the methods of prioritization. And triage is really nothing more than just a categorization system, di ba? Dito papasok yung severity of the illness or an injury. It's really used in the emergency or disaster situation, di ba? To determine which patients may have an injury, baka may illness, some sort of, you know, exacerbation of this process, or probably how we should then treat, di ba? A method for prioritization for this type of situations. So yan, papasok dito yung mga algorithms, di ba? Yung mga color coding, baka meron ding alam niyo yung mga SC, right? Emergency Severity Index. This is really algorithm used by emergency rooms to triage patients. So emergency severity index really used in a day day-to-day life situation in the emergency room triage. What it does is it really helps us answer which patient needs to be addressed faster. So yung number one, does the situation require a life-saving intermediate intervention? Number two, is the situation high risk, patient lethargic, confused, or maybe in distress or in a lot of pain? Vital signs, is it on a normal or dangerous range? And yung mga resources na tinatawag, so pasok dyan kung yung kailangan ba ng mga oxygen status, baka kailangan lang ng prescription, di ba? Resources. So I don't have here the the overview here, but on the algorithm, but really important yan, di ba? When we talk about triaging, it's something that we use to gauge the severity of different patients. Sige, papasok dito yung ito. Kunyari yan, injury triage, syempre, it's a yes or no if the patient is survivable. Yun na lang. Lalo na when we see or use our clinical eye or judgment. Life-threatening ba yan? Mamatay na ba yan? At ay galing pala sa accident. So, kailangan mag-CPR or baka talaga. MI, then nag-progress sa loss of consciousness at nawawala pala yung pulse rate or something else like that. Okay? So, if it's not, we proceed to a next level. Yung mga non-survivable injury. Ayan, alam naman natin kung who is the stable, who is emergent, who kailangan papasok pa din yung airway, di ba? Babalik dito tayo sa requiring a life-saving immediate intervention. Yan yung mga severe hemorrhagic bleeding, tapos nahirapan talaga huminga, or kailangan i-CPR, kailangan ng mga ACLS, di ba? Intervention, drugs, ACLS drugs, epi, norepinephrine, dopamine. Papasok na yung next level. Is it high risk? Patient is being confused or lethargic. At yan yung pain, siguro yan, papasok pa rin yung sobrang severe yung pain. 7 out of 10, 8 out of 10. Next would be vital signs. So, syempre in the emergency department, they might also say the patient has an emergent needs. Ayan, paulit-ulit, diba? Urgent saka non-urgent. Still, the patient kailangan ba maghintay or we must take care of them right now? They need immediate treatment. Ayan yung mga situations like trauma, stroke, MI, head injuries, saka yung syempre problem with airway and breathing. Diba? For many of these injuries, syempre may mga time-specific pa rin yung mga concerns dito. Certain things must be done. Okay, ay baka kailangan lang ng emergency sa operating room or kailangan ng kailangan syempre mag-x-ray or i-stabilize lang yung patient. Needs to be seen in another next hours. Like may fever, hypertension, probably may fracture as well. So, we must get mga further treatment interventions. Kailangan pala ng IV, hydration, ng blood pressure medications, kailangan establish patient fracture, kailangan muna x-ray syempre. And then, this patient needs to be seen within the next hours. Baka tumatas yung blood pressure niya, but still, stable, or hindi naman sobrang taas pa, di ba? This issue could be addressed later on. But still, we give prior or further importance pa rin, di ba? We have some time with this pa. It's not completely emergent. So, it's urgent. So, next, non-urgent. Stable patients with minor injuries, baka nag-sprain lang or sa sports-related injury. They may have a cold, a virus, typical emergency na pumupunta lang sa emergency, but it's not really emergency. Diba? But something should be addressed after 2 hours or stay put lang sila dyan. Lang natin nila. I-prioritize later on. We could have more couple of hours from the rest. Diba? Papasok dito yung mga ACLS natin sa emergency. We have more than enough to prioritize. At syempre, sinasabi ko naman, di ba, yung time, very essence here when we talking about triage. So ayan, situations like disaster naman, syempre, lalo na bugso-bugso na yung patient natin sa ER or sa emergency. In disaster situation, syempre, they are separated by the survivability. Injury, we say that they're in, but kailangan malaman natin, are there any immediate threat of death? Diba? They get this color, mga color coding, red, black, patay na pala. Or is it stable? Or pwedeng ma-delay, diba? Or the non-survivable injury. So yellow, red, delay. So later on, we will discuss that. So pwedeng green, minor lang. And yun nga dito, papasok yung survivability of the injuries. We should be separate from, kailangan yung benefits will affect the risk as well. Sige. If the patient is stable, ayan. Or versus the emergent. Ayan. So here is an example sa disaster. So kailangan syempre able to walk, ma-minor na natin yan, din na agad, di ba? Ilipat na natin sa secondary triage. And then of course, una pa rin yung question natin is there is a spontaneous bleeding. If it's immediate, syempre sobrang taas ng RR 30. Immediate. Disaster tayo ha. Up niya, black na siya, syempre, expected, hindi na natin priority. Lalo na, we will tag that as black triage. Unlikely to survive. So, check for airway. Pag less than 30 or, baka yung perfusion status ang next level natin dito. Is the capillary present less than 2 or more than 2, diba? Or radial pulse is also absent. Absent, syempre, kailangan yan for sure. Baka i-CPR yan, diba? Immediate or red, itatag as red. It could be used for immediate intervention or kailangan na i-transport. They need medical attention kasi nga the 60-minute survival is really important here. So compromise yung airway, breathing still, and circulation. So less than 2 naman, or syempre normal yung capillary fill or may present yung pulse, we proceed to mental status. Are they obeying commands or not? Syempre pag hindi gumagalaw si patient or not, di nagagalaw yung katawan niya, probably still i-delay yung may nag-obey ng commands. Yellow pa rin. So pinaka-shortcut dito, syempre, pag naka-obey ng commands, tapos okay naman lahat, so yellow na agad natin yan, okay? Tapos sa immediate, ang pinaka-shortcut dito, syempre, ayan, more than 30, tapos spontaneous yung, yung airway wala, pero it does not obey commands. So kailangan ng mga airway breathing circulation na intervention. The rest, green, yung nakakalakad. Walking wounded, lalo na pag disaster nursing. So yellow, yan, chill lang din. Next to the minor, and then wala na talaga kasi kailangan natin prioritize yung mga pwede pang mag-survive, especially on disaster or the triage nursing. Okay? So that is just an overview. So let's try this, some of the examples. So there are 4 ambulances arrived to the ER. The nurses know which of the following should be prioritized first. C. So letter D muna tayo. Fall off bike. Ayan, nahulog lang sa bike. May deformity, for sure. May fracture. May bluish fingers. Ayan. Siyempre, i-delay natin yan. Dahil the patient should be seen next naman from the others. Baka may apparent circulation problem or possible loss of yan, baka sa arms or sa fingers. So limb. So loss of life is higher from versus loss of limb. Fish hook caught in the lower lip. Ayan, medyo stable pa yung patient. Stable, not at risk for life or limb situation, not priority. Motor vehicle collision with neck and back pain and limited range of motion. May pain lang daw. Limited ROM. Important to be evaluation. Baka may fracture nga or mga spinal fracture or kailangan neck stabilization should be done. Anong iunahin nyo? Bleeding or severe bleeding or may pain lang? Diba? For sure, of course, priority natin yung may bleeding. Diba? The client through ghost pa. Diba? Kailangan mas immediate or mas kailangan pa talaga yung i-compress. Diba? Active bleeding put at the risk for shock, right? Bleeding. Priority over the others. So letter A. Okay? Letter A. First. Anong sagot dito? Ay, next. Sa letter A, okay? Sige. There are 4 patients again. One bed is available. One bed is available. Which of the following clients waiting to be seen is the priority? Sige, parang medyo stable naman lang ng patient dito. But still, tingnan nyo. Dizziness for the past hours. Letter B, normal sinus rhythm. Edi stable, right? Normal daw eh. Pwedeng pa-open muna natin yan siguro. Wag natin ilagay yung bed. Deformities but with normal vital signs. Nag-skating pero may deformity lang daw. Stable pala. Normal pala. Sorry. Normal. Normal. Normal, right? 1 week with sinus tachycardia. The sinus tachycardia. Or patient for safety. Kasi nga, isa lang yung bed natin. Fall of Coumadin. Nakakumadin at nahulog. Di ba? Ano ba pag may Coumadin? Of course, it's a anticoagulant. Si patient naman may diarrhea, may nausea. 1 week pa naman. So probably, is it stable versus the patient na nahulog, di ba? Basta-basta. Pero alert pa naman, pero oriented, but still baka may underlying complications yung mga ganyan patients. So the answer should be letter. If you want to change your answer, C or D. Sinus tachycardia, medyo mataas but still, di ba? Probably stable yan, normal yan mga patient. Ako, nagsa-sinus tachycardia ako sa ECG, right? 1 week pa yung vomiting. So, letter D. The major concern, syempre, yung fall na may Coumadin here. Syempre, baka may hemorrhagic stroke or subdural hematoma. Even though the client is experiencing, wala pang neurologic effect, right, or deficits. But the sooner the client is assessed, kailangan ma-test na yan, ma-laboratory na yan, ma-imaging or something else like that, diba? The better the outcome. Versus sa patient, medyo 1 week na siya nagdadias, sinus tachycardia naman, still cardiac related, but diba? If we choose C over D, mas stable yung C actually. Sinus tachycardia lang naman yan, normal yan. Still, mataas yung pulse, but this patient at risk for hemorrhagic stroke or hematoma, diba? So, letter D po yan. So, letter D. Okay, letter D. Okay, clear? Letter D yan. Letter D. Lahat of the patient are stable naman. A, B, C are stable. Although nakita nyo kasi alert-oriented naman. Still, yung may complications later on. C, nausea, vomiting, diarrhea. 1 week naman, stable yan. Okay lang yan. Later on na yan. Baka kailangan ng hydration. Walang yan. Okay? May mga naglagay dito electrolytes. Yan, important pa rin yan. But safety yung issue dito rin. Yung concern. Okay? So, letter D. Next. The nurse is assigned to a group of 4 patients. Who should you see first? ABA and nagkakaroon tayo. So A, B, C, and D. Let's try. A client at risk without a bed alarm on. So ano ba kung unahin natin? Of course, syempre, full risk naman without a bed alarm on. Later on, it's a potential safety pa rin yung concern. But it is not an actual problem, right? Yung kanina, may actual problem naman yung patient, di ba? Nag-fall, tapos nakakoma din. This one, fall risk. Fall risk. Ako ba yun? Parang nag-doble yung So letter C, it's a potential concern but it's not an actual problem. Okay? Renal failure, di ba? Mataas naman talaga yung potassium ng patient na may renal failure. It could be an expected finding for these patients. So baka kailangan ng baka dialysis, right? Or immediate intervention, but hindi naman critical. Important din yan, but still, let's see letter B. Ventilator with cane stokes respiration. Diba? Pag may cane stoke respiration, there could be a apnea, may hyperventilation, there could be a periodic form of breathing pa naman. So this patient has an underlying pattern of respiration, but it does not place the client at risk while naka-ventilated naman siya. Ventilator naman siya, okay? So, naka-ventilator. Although airway kasi, di ba? Yung naisip niya siguro. So, we move forward to patient weight, di ba? 178 yung risk. Hypertension mataas. 178. Systolic. The patient has a, graft or may bypass na tinatawag. They are risk for, syempre, possible, because of the hypertension. It could be baka magkaroon ng rupture of the vessels. Kailangan ma-address yung mga ganyan situations due to this situation, di ba? Letter A versus the others. The B, C, and D could be unexpected for this patient. Pero sa mga patient na may bypass, di ba? Sobrang taas niyan. There could be a rupture of the vessel. So this could be seen first versus the others. Okay? So, they are at least for the rupture. So letter A. Next. So ABC, mukhang wala namang airway and breathing na concern. So we proceed to circulation. Finger injury, maliit lang. Di ba? Stable. Back pain, nahulog sa stairs, drunk, stable pa rin yan. But, may bleeding concerns yung C and D. Vaginal bleeding, tapos pregnant naman pala siya. Tapos the patient having hemophilia, diba? It's a bleeding disorder. Spontaneous bleeding ang may patient na may hemophilia, diba? And especially paano kung ganyan, may laceration pa yung patient. So if you are to choose which one is really concerning, diba? Yung pregnancy, syempre may magbe-bleed talaga yan for sure. But is it risk for death or madali bang makontrol, di ba? Kasi pag vaginal bleeding naman, control naman agad yan eh. Di ba? This client should be seen as second, di ba? Versus the patient who are hemophilia, di ba? Mas yan ano na siya, inherited bleeding disorder. Tapos, sobrang concerning. 12-inch long, mahaba, parang isang ruler. 1 inch deep pa. Tapos may laceration pa sa right upper leg. Okay? So anyone with a large cut would have a problems in controlling the bleeding. Mahirap yan, lalo na hemophilia. They lose a lot of blood. They lose a lot of blood quickly. Seen first, di ba? Hemophilia versus pregnant. Letter D. Okay? So majority answered the right answer. So letter D. I think we have another presenter from Miss Maria from LEGATO.
Yes, from LEGATO. But before we will introduce the speaker, we would like to flash a video first of LEGATO.
Okay.
A strong corporate heritage, core values deeply rooted in our culture, and unwavering commitment to excellence are at the heart of LEGATO's success. With a team of over 25,000 associates and growing, LEGATO brings together the best of people, processes, and technology in our mission to innovate and transform healthcare for humanity. In a competitive market, LEGATO India has built a reputation of being a leading service provider with deep expertise in healthcare operations. LEGATO Philippines embodies the Malasakit spirit, where every customer receives a unique experience genuinely centered in compassion. This is a distinguishable characteristic of LEGATO Philippines' customer experience capability that is being built in its niche nurse talent through the Clinical Skills Lab, among other capabilities. LEGATO established a research and development hub in Limerick, Ireland, where our team of expert data scientists and artificial intelligence engineers will build and iterate application and AI solutions to make healthcare simpler, more affordable, and more accessible for everyone. The LEGATO teams provide end-to-end support across core business areas, including membership, customer service, claims, and clinical operations. Our digital and data analytics and technology services and business process as a service offerings help organizations stay resilient and maintain business continuity and improve clients' overall experience and service delivery. With a shared vision and common purpose, LEGATO teams have achieved some amazing results. Reduced production time during transitions from 30 to 50%, aggressive automation, and creating end-to-end teams to solve business problems with more agility and efficiency. Delivered over $500 million in value and expect to deliver hundreds of millions more in the next 3 years. In today's world, LEGATO is helping execute the future of work with end-to-end capabilities and vision. With competency in exponential technologies like artificial intelligence, machine learning, and digital technologies, LEGATO is uniquely positioned to define the future of healthcare technology. As the world becomes smaller and more interconnected, Legato is building communities of care to help humanity thrive. With a forward-thinking, digital-first approach, a young, talented team, and a can-do spirit, Legato has the speed of a startup and the scale of an enterprise. We are Legato.
All right, so we have here Miss Mary Lourdes Aloro from Legato to further talk about their company.
Thank you. Thanks, everyone. Good morning, dear nurses. So my name is Mary Aloro, BSN class of 2007, and currently the learning manager in the clinical tower of Legato Health Technologies. So I hope you guys are enjoying the session and learning a lot on your webinar today. And thank you, One Nurse, for giving us the opportunity to introduce our company and share some of our exciting opportunities for you, our nurses. So if you have not heard of LEGATO yet, LEGATO Health Technologies is a great place to work certified company, and it is a global capability center of one of the leading U.S. healthcare insurance companies in the U.S., which is Elevance, formerly known as Anthem. We manage clinical service delivery here in the Philippines, and we have built capability programs to build USRNs here in our country, and then provide you guys with domain expertise trainings to set you guys up for success in the global space. So I'll talk to you more about our learning programs in a bit, but let me just give you guys a quick overview on the different roles we have in the clinical space. So most of our businesses revolve around utilization management nursing, wherein your role as a nurse is to ensure that healthcare services are being administered with quality, cost efficiency, and of course, in compliance with the US standards of care. Meaning, we have to ensure that our patients would not receive treatments which are medically unnecessary and ineffective. And to give you guys a mental picture on how the nurse's day would look like at work on a daily basis, we generally do three things. One is to review the patient's clinical information. Second is we review the requests, and then there are varying types of requests. It could be a prior authorization request, concurrent request, or a post-service request. But do not be intimidated by those things. As mentioned, when you join the company, we'll train you guys on all of those things. And then finally, it is actually your ability to use your clinical decision making, using your knowledge and critical thinking skills to provide a disposition, again, being an advocate of quality and efficient care. So all of the things that you're learning from the review, your foundational concepts of nursing, those would really be critical when you decide to join us and do the job on a daily basis. So I hope that is sounding exciting for everyone. So don't worry, as mentioned, we provide our nurses best in class learning programs to equip you with your daily activities. Most of our openings require for you to have a USRN license, but if you do not have it yet, but planning to take it soon and aspiring to become one after you successfully pass our national licensure examination, we actually offer an NCLEX review program in our academy, wherein you'll be hired as a nurse trainee and just attend the NCLEX review full time. That means full hour within the shift with our amazing clinical instructors. They are seasoned and also mostly deans as well from the academy. This means that you get to be full-time employees just doing the reviews and helping you achieve your dreams to become USRNs. All expenses like the documentation expenses and test fees will be paid for by the company. And then as soon as you successfully pass NCLEX, that's when we endorse you for training on the utilization management function I kind of give you an idea on earlier. That's when we teach you the different systems, the different clinical criteria, and the necessary workflow process. Our company is in hypergrowth. You guys all know that nurses are globally in demand right now. So to also share, we have a lot of success stories of PHRNs joining our company without experience in utilization management, took the NCLEX through our program, passed NCLEX, became successful in their roles, and have now gotten promoted to leadership roles like assistant managers or team leaders or trainers. So in LEGATO, we recognize all of your limitless potentials and you can explore possibilities for your career with us. And we provide a great environment for each of you. And if you want to know more about our job openings, or if you're wondering what the compensation range is and our other amazing benefits, please visit our social media. We are on Facebook, LinkedIn, and Instagram, and you can connect with our recruiters at our virtual recruitment lobbies. So I guess that's it for me, and thank you for listening, and One Nurse again for giving us the opportunity. We wish you guys all the best in your exams. Let's all claim it. It's already ours, and hope to see some of you soon with us. Happy Sunday, unless anyone has any quick questions that we can call. Thank you.
Yeah, my question. I have a question. What if I just had my license as a new nurse? I don't have experience, especially for our students here. Baka ano lang nila, are they eligible to apply?
Yes, they are eligible to apply in our company. So again, just visit our websites, especially on Facebook, because there's a virtual lobby there, and one of our recruiters will be answering all of your questions. You guys are all welcome to apply. That's why we're here.
All right. Thank you so much, ma'am, for Mary from Legato. So yan, if you're done with the bedside nursing, pwede din kayong dumiretso kay Legato because their compensation is also really, talagang in demand din sila. Yung mga utilization review natin. I actually work with, dati rin mga utilization review. Maganda yan. Na aspect of care, especially on the, lalo na sa ibang companies sa US when you want to become a USRN as well. So thank you so much, Legato, and also please do visit their websites. Thank you.
Thanks, everyone.
All right, so let's move forward with our next question. This is our actually last question for the review. Ayan. See first again. A client with pneumonia who needs wound care and left foot ulcer. So, syempre may pneumonia. Tapos yung ang needs lang naman niya, di ba, stable naman, wound care lang. And then ulcer, right? So this patient is not urgent and it should be completed last. Di naman sinabing hirapan siya ngayon, right? Sa letter D. Mga antibiotics na yan, ongoing. A client with abdominal pain. Sige, next na natin muna yan. A client with asthma ay may headache lang naman pala din yung patient na may asthma. Hindi naman sinabing nahirapan huminga. So this may be done later on. Bigyan natin ng pain reliever, di ba? Pain or the patient with colon cancer is having MSCs. So, nagsusuka, right? Or yun, may process of vomiting versus the patient is a lot of pain. Anong sagot ng iba dito? Letter B. So, mali na letter B. Letter A. Tapos may letter C din. MSCs. Are there any risk for airway obstruction? Or the patient really a lot of pain? Okay, abdominal pain with severe pain, 10 out of 10. Airway or pain? Although, syempre, pag nagkaroon MSS, syempre, probably there could be a risk for airway obstruction. But the thing here is the patient is chronic condition naman, colon cancer. This one is acute, abdominal pain. But on the severe side of pain. So, anong unahin nyo dyan? Urgent versus the pain na severe pain. Sige, pili kayo ulit. A or C? Sa chat. Yung mga sumagot ng A, palitan nyo yung sagot nyo. I mean, yung sumagot ng B or D. C. C na. Sige. C. C na. Sige, siguro on the other side, pwedeng pagsabayin yung mga yung patient na yan. But still, who are risk for airway as well, di ba? Airway, breathing, circulation. So letter C, MSCs, di ba? Really at risk for the patients for having, cancer, mga risk for aspiration, risk for airway obstruction, dahil nga may MSCs, they are having chronic condition, and immunocompromised as well. Siguro si pain, on the other side, siguro pag sa SC ang tinatawag or yung triaging, pwede yan ma-prioritize. But thinking the airway is priority sa abdominal pain, syempre pain yan. May pain talaga yan, for sure, 10 out of 10. So we could see here in the clinical picture that this patient on the C side is my priority or our priority, okay, versus the others. So letter C. All right, I think I will synthesize my lecture. Syempre, really important pa rin yung knowing the prioritization. You know how to delegate, how to prioritize your patients, know what is emergent versus urgent. What if thinking na you have to do your clinical adjustment. Use your clinical eye and papasok dito yung clinical reasoning mo with your patient. Really important as nurses, i-check yung condition ng patient, di ba? Ang typical patient na to, normal lang ba to sa kanya? Pero abnormal on the outside, pero normal lang may ganong situation. And then, the risk versus the benefits, really important here, just to synthesize this situation. And in the ER setting, syempre, mabilis yung fast-paced environment. And time is really an important situation that we need to consider as well. Okay? All right, this is our last activity. Please register sa ClassPoint app. And then the first or the top students, top 3. So we will reset that yung tawag ito, yung point system. So yung point system ng ClassPoint, yun yung natin. So please do register. Each question have 2-minute limited timer. We don't have quizzes, so we will use ClassPoint and then limited to 200. So we are less than 200 here. Hopefully you'll join through the ClassPoint. Okay? Sige, paki-type, paki-join ang ClassPoint. 58, 59. Register on the above code. 63 going up. Please join. The rest, hindi magkaroon ng price or possible price yung mga nasa chat box, okay? Yung link ito, this one, punta ko yung link, classpoint.app, yung link dyan. Sabi ni Princess. Type mo to sa browser mo sa Google Chrome, classpoint.app 21768 or paki-QR code, okay? 68. Going up. 69. So let's start in 1 minute. Naka-register na Princess. Yan yung classpoint.app. URL, type mo yung code. Going up, 77, 30 seconds. 79. 20 seconds. Punta ka sa classpoint.app si Jenef. Type mo dun sa Google Chrome mo, classpoint.app, tapos type mo yung code. May lalabas doon. 82. URL classpoint.app and then my class code. 10 seconds, 9, 8, 7, 6, 5, 4, 3. Punta ulit sa classpoint.app, browser, type 88. Habol pa 5, 4, 3, 2, 1. So your first question. The rest may use the chat box if you want. Let's stop. The patient with having a struck in the head and a baseball bat. May pain naman daw, headache. Ano uunahin mo? Possible. Could be a mechanism of injury. We need to immobilize the patient. Vital signs, protocol naman yan, di ba? Lagi yung vital signs. What we could do later on as well. And we need to stabilize the patient. Dahil nga, there's a head injury as well and nagkaroon ng headache, then pain, stabilization is here. Eyes for swelling or on the injury, important yan, di ba? Pero hindi naman yan immediate or pwede natin pagawin yan later on. Loss of consciousness or we need to immobilize the spine. Okay? So, syempre, while the loss of consciousness is really important here to determine the possibility of sa bleeding or intracranial bleeding, right? It is that, syempre, kailangan is immobilize muna natin si patient, di ba? Because there is a mechanism of injury. It could be suggestive of mga problems sa spine involvement as well as, yan nga, may referred pain to the deltoid area. So, kailangan ma-apply muna natin yung spine, C-spine immobilization. And then, really, still, the next will follow. Kailangan, the pain here, still, di ba? Indication the, nagpipain siya, so coherent naman si patient, di ba? So, sabi niya, may sakit yung ulo niya, may pain. So, probably, stable si patient. Walang loss of consciousness. So, letter D. Pag may nangyari, kailangan mobilize, lalo na yung mga patient na may injury, lalo na sa ganitong situation. Okay, so the answer is letter D. Okay. Sinong una? Leaderboard, Jen and Michelle and Padilla. Next. Five, four, three, two, one. So, alamin muna natin sino yung mga stable dito. Urinary burning, upon urinary frequency, baka may UTI lang. So, it's not an emergency. Patient is stable. Pwedeng mag-wait. Anong sagot nyo? Letters B daw. A, B, C. Dizziness and headache behind the right eye. Light sensitivity. So, baka may migraine, right? Pain is localized. Photosensitive is present. And the patient might be still stable pa rin. Bilateral leg numbness, ambulatory. Stable, okay? Stable. Ayan, na-stab yung wound pero kahit na-control ng, tourniquet, not only does this patient likely to have an arterial injury, di ba? Even the tourniquet is applied, it slows the distal circulation, di ba? Just because the bleeding is controlled, it does not mean that this is the priority. these clients needs to be seen immediately due to having likely a arterial injury. So letter B. The rest, medyo stable pa. Okay, letter B. So, ano may mas stable dyan? Si diaphoretic, right? Airway, breathing, circulation. Heart rate, pwedeng emergency pa rin, but still, we'd go for airway. A or C? Kasi maraming factors bakit tumatas ang RR, right? Pwedeng may anxiety, pwedeng may pain, or other concerns, or pwedeng mga benign situation lang, di ba? Ano ba ang indicative of serious situation dito? Lalo na papasok dito yung airway and breathing. Nasagot ng iba, sorry. Ano yung response, no? A and letter C. Elevated RR, concerning. Uneven chest rise and fall is also concerning. Baka si patient might having a, yan nga, pneumothorax. Kasi nga, there could be a collapse lang. So, pag may collapse lang, syempre, emergency yan, di ba? There is nothing, really important here or to prioritize, but yung uneven chest rise and fall, because this should be alerted, di ba? Airway and breathing. So, pwedeng pagsabayan, but thinking na CRR pwedeng na may mga benign situation, baka may anxiety lang naman. Although kulang kasi, di ba? So, letter C, mas concerning here, okay? So, C. So, A might be, hindi kulang kasi, di ba? Probably due to benign situation. Lalo na sa emergency, may mga anxiety lang pala, or sa pain. Or baka naman baby pa naman yan, or bata pa yan, kaya mataas yung RR, right? So, letter C is the concerning here. High respiratory, concerning, but still, it could be on the benign situation. So, letter C. Next. concerning lahat may abdominal symptoms. Abdominal swelling, ecchymosis, is that a bleeding concern? Yes, right? Baka may internal bleeding. Right upper quadrant, pwedeng may problem sa liver or gallbladder. Abdominal movement with no bowel movement. So, pwedeng mga constipation tong dalawa na to. Constipated talaga. No bowel yung isa eh. Ito LLQ. So, probably due to some sort of constipation versus bleeding. So, ano unahin niyo? Bleeding or mga constipation lang or mas stable on the pain? Diba? So, nagkakaroon ng bruises, ecchymosis, especially on the inside. This is the much more concerning, diba? There could be some sort of internal bleeding on the patient. So, letter, nasagot niyo? Letter A, correct. Letter A. Sige. So we're talking about example of a barrier to setting priorities. So syempre mga nurses, syempre there is an extra task at really toxic and stressful situations. Which of the following is an example of a barrier? Barrier. The nurse feels obligated to consider the family needs. Di ba? It's a barrier because nandiyan yung mga relatives nila, ay na mga patient. So, it could be an influence and a barrier, especially on the prioritization. So, baka kinoconsider nila yung family at syempre yung mga family nagre-reklamo yung mga yan, di ba? So, it's part of the barrier. Number 1 is a barrier. The nurse responds to whatever crisis should occur first. Ayan, syempre, as a barrier talaga when, it's really difficult for us nurses to have trouble, lalo yung mga trouble on organizing the tasks. And barriers may face when trying to prioritize tasks, lalo na kung may mga crisis na nangyari or, crisis could happen to occur at the time. So it could be a barrier. The nurse would rather do tasks versus delegate them, di ba? Sobrang hirap talaga mag-prioritize. Minsan yung mga patient, mga nurses, inaako talaga lahat yung mga tasks versus delegation. It could be a barrier. Dapat marunong ka ring mag-collaborate or coordinate with others. Okay? So delegation or failing to delegate appropriately is a barrier. Okay? So letter A. The rest, syempre, typical naman yun, di ba? Prioritization, alam niyo, dapat is a good principle of prioritization. The nurse group task because the patient is on isolation, precaution. Yan, good principle pa rin yan ng prioritization. The rest are barriers to setting priorities. Okay? 1, 2, and 3. That is letter A. Next. Sige, let's stop. Who should see first? B, C, and D, saka na yan, di ba? Pwede naman yan natin i-assist later on yung mga patient na or family member who would like to update on care. Pain or hives? May allergic reaction, baka magka-anaphylactic reaction din yan later on, right? Sobrang magana yung buong face and arms, baka mahirap. Later on, mahirapan na yung huminga. At nagmomorphine pa siya, di ba? May depression as well. So, pwedeng dahil nga sa may allergies. Pain versus allergic reaction. So, letter A, di ba? Mas dapat ito yung unahin mo. Sa pain, pwede naman bigyan natin ng may pancreatic cancer naman pala kasi. Okay? So, letter A. Next. Okay. Pag nag-half na, pwede natin i-close. Since marami pa tayong question. Sige. 5, 4, 3, 2, 1. Sige. Marami pa kasi tayong question sa'yo. The nurse in the ER have 4 clients. Prioritize for the float nurse to see. The client with which of the five should be seen first by the float nurse. A, B, C, or D. Okay. Missing teeth after a bar fight ay natanggalan ng teeth with a fat lip is stable, di ba? Abscess with pain, so but it makes the client vomit. So still is not emergency. Naswallow yung dental crown versus the patient with battle sign after a bar fight. So nakipag-away. Nagkaroon ng bruises or mga pwedeng fracture or pwedeng may potential brain damage. Sino unahin nyo? Yung nakainom ng golden dental crown? For sure, baka pwede niya rin madumi yan pag binigyan ng mga lactulose or something else, right? So letter D is the right answer here, di ba? Bruising, and then, ayan, it could indicate a potential brain damage kasi nakapag-away siya. That it needs to be seen first. The rest, stable naman yan. Okay, so letter D. C, swallowed a gold dental crown. So hindi naman compromise yung airway, di ba? Okay, ilas na natin yan. Sige, 5, 4. Sige, sagot na. 5 more seconds. 5, 4, 3, 2. Sige. Marami pa tayong question. Cerebral palsy with new pressure ulcer, pwede naman natin yung i-prioritize later on. 97 auto-sat. Although tachypneic and shortness of breath stable, di ba? They have a good, the patient have a good auto saturation at pwede namang mag-wait. Recent cardiac catheterization with a hematoma. So it's not likely to be an urgent concern, di ba? Kasi may pag nagka-cardiac for sure, usually dito sa femoral artery or sa sa femoral or dito sa radial, right? So, pwedeng magkaroon ng hematoma pa rin yung mga patient na magganyan. So, stable yan. Letter A is hindi unstable, di ba? Hypotensive, may bleeding concern, di ba? Decreased perfusion. Baka magkaroon ng pwedeng hypovolemic shock, di ba? They need to be evaluated immediately. The rest, stable. Okay? So, letter A. So, lagi nyo pa rin i-check, di ba? Kahit yung may nakita nyong airway agad yung may problema dito, pero hypotensive, may bleeding, tapos normal naman pala yung OS per O2. Stable. So, letter A. Okay? Sige, ito, 1 minute lang to. Thirty seconds. Okay, stop. Alright, yan. May bleeding concern, petechiae, may liver failure for sure, di ba? Baka may internal bleeding as well. Cellulitis with itchy, normal lang yan, di ba? Lalo na pag normal healing process na Makati talaga yan. Ovarian cyst, it could rupture on its own or it could pwedeng mawala or pwedeng surgical procedure. So later on, chronic naman pala, di ba? Pwedeng nasa kanya na yan all throughout, di ba? Pwedeng may cancer. So 8 out of 10, di ba? Letter A, you must, di ba, priority. At kailangan may further assessment, diagnostic, and treatment. So letter A. Thanks. Sige. Urgent versus emergent. Ano ba yung first priority dito? Siyempre, yung mga patient to be seen immediately, di ba? Like chest pain, number 1 yan. Mataas ang blood pressure, is it number 1? Number 2 yan. So number 4, facial weakness, di ba? It should be seen immediately. Stroke, di ba? Priority, emergent yan. Time is important, lalo na pag stroke, di ba? Wrist fracture, pwedeng second yan, urgent. Fever at blood pressure, elevated. They are considered priority 2. It's under urgent, but not an emergent. So, except 1 and 4. The answer is 2, 3, and 5. Okay? Trauma, stroke, heart attack, priority, number 1. Okay, first. Second, the rest, di ba? Number 2 or letter A. Alright, sige. Of course, syempre, patient with alteration with mental status. Headache with photophobia. So, still stable. With pregnant women, syempre, it's unexpected, di ba? Sa mga patient na may pregnant women. Okay? Ang swelling. Finger swelling over rings. Oh, Stable pa rin, di ba? Altered mental status, di ba? Dangerous, lalo na ano pa rin, febrile, baka may sepsis, di ba? It should be treated immediately. Letter D. For pediatric patient, a bed becomes available and the triage nurse to take back the client with which of the following first? So, ayan. An open fracture but no hemorrhage, stable. Epistaxis, nose bleeding. Although, you know, syempre, ensure blood loss is still minimal, di ba, for the patient with this. But versus, yan, exacerbation, 100% pala yung O2. On-room air, stable. So, ano mas stable dyan? Epistaxis or yung fever na sobrang taas, di ba? Priority versus the other. So, letter A, di ba? Febrile, high risk for seizure si patient. Unstable yung vital signs. Epistaxis, pwede yung ma-stabilize. We should treat the fever first, okay? This for seizure. So, letter D. Ang sagot nyo. Yan, letter. May mga B versus D. Okay, D. Five, four, three, two, one. Yan. Triage in a disaster, red tag. A client with spinal injury, slow, irregular respiration. A client with deep laceration of the head and requires stitches. Yellow to. Yellow. A client with chest wound and RR, sobrang taas, immediate. Broken arm, green. Yung letter A, irregular respiration, pwedeng ano yan, block yan. Likelihood of survival is minimal. Chest wound, RR38 red. Okay, letter C. C, di ba? Red tag yan. Letter C. Yung A, saka na yan. Huli na yan kasi they should receive black tag because of the survival is minimal na. Okay? Mas okay pa yung i-red tag si letter C. Severe injury with potential pa rin. They have the potential for survival. Okay? Ano to? Ay, yun yung sagot kanina. Tanong kanina. So, bonus to. So, bonus na to. 30 seconds. Bigyan ko kayo ng 30 seconds to answer. So, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Ayan. Nakinig. So, letter A, di ba? There is a airway concern here for letter A. Last 5 slides. Tapos, we're concluding our presentation. Okay, bilis na. A or C? The nurse is starting the shift. Nasa hospital kayo, yung settings ha. Receiving reports on client to be done and start the prioritizing. In which order should the nurse prioritize the activities? Sino ang unstable? Siyempre, yun yung unahin. Yun, nasa hospital tayo, di ba? Complaining of pain, complaining or being responsive. Ito, medication daw. So, a client who take his medication with breakfast has just arrived. Stable. Who wants to take a shower? Stable. Tapos, unresponsive. Ito, pain when he moves his shoulder. Pwedeng stable din naman lahat. Ano na unahin niya yung unresponsive patient, di ba? Important here to prioritize. Unresponsive, tapos medication actually. Kailangan niya ng medication with breakfast. Tapos the rest, mga ibang needs naman si patient or potential for something else. So 2, na to, unresponsive, of course, 2. Pain with shoulders, gusto mag-shower, edi 2, 1, 3, 4. Gamot, tapos nag-complain lang pain sa shoulder, tapos gusto mag-shower. Okay, 2, 1, 3, 4. The answer here is letter D. Okay? Unresponsive, tapos medication, the rest pain lang, tapos shower. Okay? 2, 1, 3, 4. Next. Sige, we're almost done. 5, 4, 3, 2. Ayan. May problema? Of course, lagi yan sa ER. Siyempre, may financial problem and then other resources, di ba? Problems sa resources like yan, sa bahay. The patient or the nurse discovered the client is homeless. Anong gagawin mo as a nurse sa client? You cannot discharge. Siyempre, kailangan pawin natin yan, di ba? May meal coupon. Wala nang sinabing may problema sa pagkain. But homeless naman. Papauwi mo, tapos ililipat mo sa local shelter. Siyempre, dapat consult tayo sa mga social worker. Marami yan sa hospital. At we need to provide them or we need to have the social worker assess yung mga resources, lalo na sa shelter, lalo na mga patient, diba? Yung mga homeless talaga people to provide resources to stay. Kailangan i-assess ni social worker din. Siyempre, there is a safety concern. Diba? Letter C, kailangan mag-collaborate sa social worker. And then last 2 question. Kita pa. Connect. Line. Number 3, ano to? Comfort. Oxygen, connect to the client to hemodynamic monitoring. C. D. Comfort and support. Ten seconds. Alright. Suicidal, elevated RR, although wala sinabing SpO2, but irritable, withdrawn, which is the priority. Saka na tayo magtanong, saka na natin hanapin si doctor, saka na tayo although important yung comfort and support, right? But intervention, like yan, connect to the client with hemodynamic monitoring, applying oxygen, yan, it's the prioritization versus the others. Okay, letter C. Next. Ten seconds. 5, 4, 3, 2. Of course, diba? We need to understand yung mga emergent, diba? Urgent, life-threatening situation or life-threatening condition. That is our first question here. The rest will follow. Last 2 questions and then we're done. 10 seconds. Okay, is it a life-threatening situation? Diba? Low blood sugar, alert naman, oriented. COPD with 91% autosat, normal din ang may COPD na normal lang yan, di ba? 91%. Mental status or patient with hypotensive or cardiogenic shock, di ba? So letter C, yeah, must prioritize. Yan, yung letter C. A patient with hypotension with cardiogenic shock. It's because of the immediate threat to safety and survival. Okay? The rest stable. And then last question. This is my last question for you. Alright, di ba? Airway, of course. First order of priority for providing patients, especially in the emergency. Lalo na pag ikaw yung, supervisor. The rest will follow. Okay? Sa letter B. Alright, so syempre, thank you for your kind attention. And I don't have a quote here, but you see here, there's plants or yan yung plant na mag-isa lang siya, but still we're talking about growth. Yan yung opportunities that could be provided, especially when you become an unofficially nurse someday. Syempre, we're talking about growth. The journey is never ending. There's always gonna be growth, improvement, adversity. You just got to take it all in, what's right and what is important at the moment, di ba? Continue to live in the moment. Kailangan continuous yung road natin. We strive not just perfection, right? But progress, improvement, achievement, and success have no meaning without continual growth. Learning to control yourself as well, being more responsible, especially you as student nurses, becoming more responsible, learning new things, developing new skills, changing your mindset, becoming more positive. And that, plant will grow all throughout. Kahit nandiyan siya sa mag-isa siya, di ba? Syempre, you have your own ways to grow. And there could be problems or difficulties, pero dapat yung you need to be awakened to desire to grow. Syempre, it will lead your life to change your life as well. Kailangan you aspire to take that step. And then, syempre, hindi naman madaling maging success, but, little step is really important. At yan, someday, you'll grow as big as that plant. Maging tree, expand your knowledge, develop your self-awareness, skills, developing new skills as I mentioned. And explore lang, di ba? Find what is suitable for you. And thank you so much for your kind attention. And this is my presentation for today. And check natin sino winners. So thank you very much. And this is my references. Ayan, Natasha, Charmaine Olbo. Let's screenshot. Paki-screenshot, Ma'am Maria. Ito man. Jacinto de la Cruz and Olbo. Sige, isi-save ko to later on. All right, thank you so much. And may other ano ka ba, Maria?
No, but I'd like to give the certificate of appreciation to you, Sir Royce. Thanks for being the all-around today. Okay, I'll just share my screen for the certificate. So, yes, to award the certificate of appreciation to Professor Royce Narvaez, MSN-RN, for sharing his exemplary knowledge, experience, and expertise as a guest speaker on the Wonders NLE Review webinar series with the topic Prioritization and Triage in Nursing, given this 23rd day of October 2022, signed by our founder of Wonders.com, Hirojit Singh Rajkumar. And to everyone, let's give a thumbs up to Sir Royce, or maybe a heart in the comment section. Thank you so much, Sir Royce. Thanks, everyone.
All right, thank you so much. And we have our evaluation link. We will provide it to you. And hopefully you'll invite others in the next sessions. And yeah, have a great day. And please wait for the link of the evaluation. Ano ba yun? I-project namin. And then
Maybe we can do in the chat box, sir. I will be sharing some
If-
videos.
Correct. So the link is open for the evaluation. Please do check at that. For those who have or first time here, may Google Class tayo. Doon kayo pumasok para makita niyo yung recording. We will upload the recordings. Just give us time, okay? And I will share this presentation to you as well, okay?
I'll start sharing na, Sir Royce.
Okay, sige.
They say when you're doing what you love, you won't work a single day. At LEGATO Philippines, we don't call it work. We call it purpose. LEGATO is a company born out of the purpose and desire to transform healthcare by improving the lives of people and the communities they live in. At LEGATO, it's not just a job, it's a calling.
Today, we are this many associates strong.
In 2 locations in the Philippines. They are the soul and the spirit that live and thrive within these functional business towers. And we need more to heed the call from all walks of life. More people like you, and you, and you, and you. At LEGATO, we believe in taking care of our employees first. The benefits of being part of this group are numerous. A competitive compensation and benefits package, an incentive plan, HMO coverage on day 1, covering 2 additional dependents, vacation and sick leave with annual conversion, fixed weekends off for majority of accounts, and retirement plan plus group life insurance. But the benefits are just half of the story. We believe that a well taken care of, empowered team can empower others, the people we touch, and the communities we build. And that's what makes a company truly great. So be part of our team. Find out more about us on Facebook, LinkedIn, or on our website using these details. The application and hiring process is now fully happening online. Step 1, message us. Step 2, apply to an available opening, and then we'll get in touch for the next steps. You can also contact us here. A purpose-driven career is waiting for you.
So thank you so much for that, Legato and Chinese General, for supporting One Nurse and for this endeavor as well. Okay. So for our student, I'll share the evaluation link. Any last words, Maria?
No more. We will
No
be
more.
sending emails to all the participants for the Google Forms of the customers, the clients.
Correct. Sige.
Are you going to share screen, sir?
Yeah.
Okay.
All right. Thank you so much. Evaluate.